Okay, I'm going to be giving Mrs. Delgado, Diane Delgado, a shot of Bacillin, which is a penicillin today for an infection. I'm going to be giving her 2.4 million units. She gets this every week, so I'm going to check and see which hip she had it or which where she had it last, so make sure that I switch sides because she has it so often. And I'm going to check her date of birth here and her doctor, okay? So then I'm going to unlock my medicine cabinet, open it up, and I'm going to find my Bacillin. Okay, Bacillin. I have got 200,000 units per milliliter. I'm going to check my expiration date. And since this is multi-dose, I'm going to write down my lot number so that I have that. Okay. And since I'm ordered 2.4 million units and this comes in 2 million units, I'm going to have to do some math. So I'm going to give Mrs. Delgado 1.2 milliliters. Okay. And so I have all my supplies here. Since I'm going to give this in the ventral-gluteal, I'm going to need a 3 milliliters for the 1.2. I chose a 3 milliliter syringe. I chose a 1 or 1.5 inch needle, 23 gauge, and I'm going to switch it out with a 1.5 22 inch gauge because when you put the needle into the plunger, sometimes it dulls the needle. So we want to, and having to go deep in the muscle hurts. So I'm going to got my supplies here, and I'm going to get started. I'm going to wash my hands. And I did my first check with my supplies. I'm going to open everything up here. I'm going to clean my cap thoroughly. Okay. And then I'm going to put in 1.2 milliliters of air. Make sure my needle is below the level. And I am going to 1.2 milliliters. Make sure that I'm going to do a little bit more to get the air bubble out. There we go. All right, perfect. And now I'm going to switch out my needle. Of my needle in the sharps container, and I've got my supplies here. I'm going to do my third check. I'm going to make sure that this is the right patient, Diane Delgado. I'm going to make sure I'm giving her Bacillin 2.4 million units, and I know that works out to be 1.2 milliliters. And that's what I've got here, 1.2 milliliters. And I checked my expiration date, 2/2/20, and I'm going to check my lot number. I wrote that down. And so this is the right date that the doctor ordered, the right time. I got the right route is intramuscular, and I'm giving this medication for an infection. So I'm going to open my drawer, put my medication back in, lock my drawer, gather my supplies, and I'm going to go into Mrs. Delgado's room. Hi, Mrs. Delgado. My name is Kathy Sarno. I'm a student nurse with HCC, and I'm going to be giving you your penicillin shot today. I'm just going to close the curtain for privacy. And I see that they've already turned you on your side, getting you ready for me. Could you, can I see your wristband, Mrs. Delgado? Could you spell your last name for me? All right, great. And how about a date of birth? 1-1? Okay, 1-1. Great. Okay, so let me get, and I see your rail is up for safety over here. I'm going to get started. I'm going to wash my hands again. I'm going to put on some gloves, and I'm going to check your site. And I wanted to ask, I saw on the paperwork that you had it in the left hip last week. Okay, so we're going to do the right hip this week. So we'll switch back and forth. And I'm going to give it to you in the ventral gluteal, which I'm sure you've had it many times there. Okay. And here we go. All right, can I ask you just to move your arm a little bit for me there? Okay, so what I'm going to do, Mrs. Delgado, is I'm going to find your greater trochanter. I'm going to put my palm there, and I'm going to feel your anterior spine, iliac spine with my finger, and my first finger, and I'm going to spread my fingers, and that's right exactly where I want to give you your shot. It's in that crest. All right, and then I'm going to let that dry. I'm going to get my needle, and I'm going to give you, without losing my landmark, I'm going to give you your shot, bevel up, 90-degree angle. I am going to put this in slowly, and then I'm going to put my gauze in between my third and fourth finger. But I'm going to give it to you slowly and wait 10 seconds after I give it to you, and then I will pull the needle out. I'm going to go ahead, bevel up. Yes, 90-degree angle like a dart. I'm going to go in right up to the hilt. I'm going to aspirate. No blood. Perfect. I'm going to, my fingers would be in this position. I'm going to slowly put the medication in. And if this medication was in the refrigerator, I would have warmed it up by rubbing it between my hands. I'm going to take the needle out, apply this for 10 seconds as I put up my safety. I'm going to hold it here for 10 seconds, no rubbing. All right. And I'm going to let you know that if there's any swelling or redness or you have any type of reaction at all, to let somebody know. And I will be back in about 30 minutes to check your site. All right? So I'm going to dispose of my gloves. I'm going to wash my hands. Go back to my cart. Alright. Dispose of my supplies properly. Putting my needle in my sharps container. I am going to document that I gave Mrs. Delgado, I gave her bacillin shot at 0900. I gave it to her in, put my initials, I gave it to her in her right vastus lateralis, ventral gluteal, ventral gluteal. I gave her 2.4 million units, which ended up being 1.2 milliliters. She gets this every week, and she gets it intramuscularly. And I wrote down the lot number, and I checked for allergies already, and I checked her medical record. And I believe that's it.